Jeremy, today's episode is so important, and I'm so glad that you're here because you really wanted to come and share the importance of listening to your body and doing something about it, especially from a male's perspective.
Right.
Yeah. So thank you so much for coming here today. And Robyn, you're Jeremy's wife of 19 years. Thank you for joining us as well.
Thank you.
This is the first cancer that I don't know anyone that has had. Lance Armstrong made it famous.
Yes.
Right?
Yeah.
Tom
Green.
Oh, Tom Green. That's right.
Mm-hmm.
Yes. So tell me when you were diagnosed and what your diagnosis was.
So I was diagnosed in, what was it, late April is when I thought I had a pain in my testicle.
And this was late April of 2024.
Late April 24, yes. I was just kind of sitting around one day, and with my job, I like to keep active. I worked out quite a bit, stuff like that. I thought I just pulled something. I thought it may be a hernia at the most.
Yep.
And, I was like, well, maybe I better check it. So I checked it myself.
Well, it kind of went away, and you just kind of didn't think
just
anything
kind of
about
played it off,
Yeah.
you know. And I was like, well, that just doesn't feel right. I mean, maybe I better go to my doctor and get this checked out. And sure enough, I'll go to my general physician, who is a man that I've known. He's about the same age I am. I've known him for most of my life, buddy of mine type of thing. And I was describing to him the pain I'd felt and what the testicle felt like, trying to describe it in, Jeremy, I'm just going to have to check it out. I'm like, that's why I'm here, Mike. Just let's go, you know.
Yeah.
And so he checked it out, and of course, right off the bat, ordered a ultrasound of it, and just snowballed from there.
Where was he at, like, with certainty when he ordered that ultrasound? Was he kind of due diligence, or was he like, well, let's make sure?
No, I think he was pretty certain that he knew there was something there. He said he could feel like a ball type of thing is what he thought.
Like a mass.
But I don't know if he immediately jumped to cancer, though. I thought maybe he wasn't for sure. That's why he wanted to get the ultrasound, just to find out.
Just to make sure.
Just peace of mind.
Mm-hmm.
Yeah,
so
certainly.
we can know.
If you're going to go that far,
Right.
to check it, you want to make sure.
Yes.
So, I mean, that sounds fairly common. Like, I mean, the mentality that you had, I mean, I literally just had a similar situation where just kind of have like a nagging gym injury for a couple of weeks, and I don't know, I feel like kind of went away today, and now it's back, and I'm sure you don't want it to become anything as well. So I don't know, especially if you're a big active guy, you're probably used to dealing with a little bit of pain and writing it off. And
well, the older we get, the more pains stick around, and the harder to fix up. And
so how long did you let it go, more or less, before you got it checked out?
It wasn't but a couple days.
Oh, okay.
I've always been, I lost my father at a very young age. He was 38 years old, had the classic symptoms of pain down the arm, pain here, and had a massive heart attack that night and passed away at 38 years old. Jeez. And I always vowed to myself that I was going to get checked out. I got good insurance, I'm going to get checked out. Everything I got wrong with me, I'm going to make sure I'm okay. And that was always in my head. I'm here for my wife, my kids, my grandson. I'm here for them. I need to stick around type of thing. So I'm going to get checked out no matter what. I need to. And it wasn't but a couple days, and I was out there knocking on Mike's door. Hey, buddy.
Oh, good for you. In my head, I just assumed it'd be a couple of weeks, but I guess I'm just projecting because that's
But that's what we talked about before when we talked to them before the recording, was that a lot of men, you even said, will put things off and be like, oh, I'll just tough it out.
Yeah, especially in the private areas like that. And Larry and whatnot.
Yeah, it's obviously
can be embarrassing, sensitive to do.
Because it kind of went away, and then one night in bed, you rolled over, and then felt it again. And we're like, okay,
What did it feel like, Jeremy?
It was just a sharp tugging pain. And I don't know, what I could describe the feeling of it as when I, checked myself, it almost felt like a piece of exploded popcorn.
Man,
is what it felt like to me. I'm like, which I knew wasn't
That's
right.
not normal.
Like to the touch is what it felt like.
To the touch,
Gotcha.
with me feeling it. And because usually it was smooth, whatever. And this definitely ain't right. So I need to go get this looked at.
So you get the ultrasound, and it comes back, and what do they tell you?
They said, we got the scan, and they're like, well, we think you need to be seen by urologist or something. And then that's how we got sent over to St. Louis then.
And then he's the one that confirmed it.
He did blood work. And he met some of the markers.
Okay.
And then still we thought it was just localized.
Referred me to the surgeon that removed it. And it was 2 days
before the surgery.
Before my surgery that they decided, maybe we better do a scan on this guy too. And all my it metastasized up the lymph nodes all the way up into my neck even. Is how far it had already traveled. And I say, without that pain, I still wouldn't have known that I had anything going on. It was, you don't realize it, but.
I'm interested, in, maybe it's something that we asked Dr. Visconti, your physician with WashU Medicine, but I was reading about testicular cancer and, just sort of the bullet point facts that, I'd read before, but I wanted to freshen up for the conversation, obviously. It's pretty rare, testicular cancer, and it's more common in younger men, is my understanding.
Right.
And it usually doesn't, what's the word?
Metastasize?
Well, yeah, metastasize, present. It normally doesn't present with pain.
Oh, okay.
Yeah.
So, again, that's just kind of a quick college effort search. But,
Right.
You said you had this pain for a couple of days.
Yeah.
It hurt.
And it wasn't a constant pain.
Yeah,
It would be
that
like
was-
just
yeah.
like a shooting pain
And
every
it
once in a while.
metastasized.
Yeah.
Yeah, well, and Robyn had actually asked Dr. Visconti after a couple visits, I think, once we got my treatments scheduled out and stuff like that. So how long has Jeremy had this? And she's, he's had it for years.
Because luckily it was a slow moving one.
Yeah.
Well,
I've had
yeah,
it for
it made all the
years.
way
I've
up
never had a,
through your body.
Yeah.
And Dr. Visconti is your oncologist,
Yes.
by the way, not the
Yes.
surgeon that did the surgery.
Yes.
Because
And-
once we had the surgery and they confirmed everything and knew it was metastasized, we asked to be referred to Siteman. Then.
So you knew about Siteman.
Right. Yes.
yes.
Yeah.
How did you react when they first said, okay, this was before the scan, they'd found it in your lymph nodes. If we can just take it back to when they first said you have testicular cancer, were you shocked?
Yes.
Oh yeah.
It was. I was, but it was like I was presented it with. Well, that was a little later, I guess. But we can remove the infected testicle. It's localized, capsulized, whatever. We're good. Well, that'll be the end of it. So kind of just like, this is just another. We'll get this passed and we'll be done with it.
Yeah.
That's my understanding,
Yeah.
too.
Right.
If someone had said that to me, I'd go, yep, all right. So 99% of the time when I hear about it, it's, okay, get rid of it, normal life.
And it's done.
Yeah.
But wasn't a part of you like, they're going to have to remove that? Like my entire life, I've known that that's the most sensitive part, right?
Yeah.
Like you always know in the school ground, you never want to
Yeah.
kick a boy in between
Yes.
his legs
Right.
unless
Yeah.
he's mean. Then you kick him in between
Yeah.
his legs, right?
Yeah.
Like how painful that is. So my first thing would have been, I'm not a guy, obviously, but like, wow, is that going to hurt? Were you asking those questions or were you just like, get it
Not
out?
Really, I was just okay. We found out what's going on here, and you hear about the big cancer word. Let's get it out. I'll be done with it. And
Yeah.
I really wasn't worried about the surgery in that area and stuff.
Because we didn't think there was not going to be any chemo or anything like
Right,
that.
I
So we
didn't-
just thought we would be
I think that's
kind of
what's-
one and
one and
done.
done, and
You know.
I think that's kind of what is interesting and unique, especially about your story is that, I can picture that, especially at this age, or at the time, you're what, 49?
Yeah.
You've got a child and a grandchild already, close to retirement. You're going, all right,
Yeah.
take it out, whatever.
Yeah.
Get this out.
I mean,
so
honestly,
I can get on with my.
Yeah.
I think most men know the base level about it, where it's like, it's very treatable. You find it.
Right.
One's as good as two as far as functionality is concerned.
Right.
Yeah.
Aesthetically, whatever.
Big deal.
Get
Yeah.
on with it. But then you find out that you've checked all these boxes that are not the norm. It sounds like, that's when you might have had that moment of, oh,
Yeah. Oh, this
okay,
is
so this is
lot more than
a
what
little
we-
more
yeah.
substantial than I thought.
He had gone to work and we knew he had the CT scan, but we were waiting for the results. And he called me that morning. I was getting my son ready for school, and I answered the phone, and I knew immediately by the way his voice was. I'm like, what's wrong? And he goes, it's metastasized. I'm like, what do you mean it's metastasized? And so he had to run out to his car, send me copies of the report, called me back. We bawled while reading through it,
was a
seeing
long
where
day of work,
it was a very,
Oh,
I think
yeah.
you actually came home early.
I think I did. Yeah.
Yeah, because that just blew our minds because we had no idea.
What was that like for you, that moment when you realized it's evolved into this?
Yeah,
now?
it was kind of like a kick in the gut. I'm like, what? How did this happen to? This ain't supposed to happen to me.
Right.
Why are we here now? All of a sudden, I'm at the end of my 28-year career. This can't be happening to me now. You know, and but the kind of reality sets in on me, I guess, a little bit. And we're like, okay, well, let's go see what we got to do. Let's go see what the next step is to get this out of me, get this controlled.
And the surgeon actually called me because he tried to call Jeremy. Of course, can't have a phone in prison, so he got a hold of me.
Well, Jeremy wasn't in prison. What do you do for a living?
Yes.
I'm sorry. Yes.
I was working there.
Working
Yes,
there,
I was
there.
a lieutenant in the prison system there.
Yes,
And-
which is why you were retiring at 50
Right.
years old.
Yes.
Yeah, so Jeremy was working in the prison.
working in
He
the
was
prison.
not in
yes.
prison.
yes. And I appreciated him reaching out to kind of talk about it and stuff. And he's like, we'll go over it more later. But
I will say I'm somewhat surprised that you missed on that opportunity when you said it was like a kick in the gut.
Yeah.
Yeah, I know.
The
The
joke
thought crossed my mind.
it's
I'm
right
trying
there.
to do good.
I know. It was funny because we were talking
Trying to
about this.
behave, my-
Talking about this
Yeah.
episode, it's like, what is it about testicles that everyone makes it so easy to joke about?
a
We don't joke about
standing
breasts
thought.
when we have breast
No.
cancer, but there's
Right.
just something about testicles.
I don't
that
know,
just
they're
make-
funny.
Yeah,
Yeah,
they're
they
funny.
are.
You know,
They're goofy.
Yeah. Well, I'm sure we'll get a couple puns in here throughout this episode. But so you get this news, and so your official diagnosis is
Just metastasis in the lymph nodes.
Did they give you like you're stage 2B
Stage
or
3.
Stage 3A?
But they never gave a.
They didn't do the ABC.
because I think
No.
testicular cancer is different how they diagnose it. Because I remember
Since it's-
Dr.
yeah.
Visconti will know.
I need to write
of course,
down Dr.
better.
Visconti will be joining us
Yeah.
later.
Yeah.
Dr.
I
Visconti.
think our big
questions.
note is Dr. Visconti will know.
Yeah.
Yeah. Yeah.
Yeah. No, but
Right.
so when they tell you you're stage 3 and that your testicular cancer is metastasized, where does the conversation go from there? I mean, I'm sure you're talking treatment, survivability. What are we
Yes.
looking at?
That was one of the first things. How bad is this?
Yeah.
You know, and right away when we got to see Dr. Visconti for the first time, I believe it was, I'm informed that it's the most treatable form of cancer there is. I'm like, hey, this is all right. Okay, I can handle this. You know, I can be a tough guy with this. Let's get this. And I totally underestimated it.
And Dr. Visconti said, he goes, I'm hitting you with an aggressive.
Yeah, he didn't hold back.
No.
He told us this is going to hurt. This
Yeah.
is going to. This
But
is,
you
I'm
didn't
gonna
quite
put you
believe
in the
him,
ringer.
right? At first, you're
Well,
kind of
like,
like,
no
"Ah."
idea.
You just told me it was the most curable form of cancer there is.
Yeah.
Yeah, I can get this. Yeah, totally underestimated it. Totally.
You had a very intense chemo regimen. Can you tell people what it was that you went through?
Sure. So it was 4 cycles of 3 weeks. Every cycle, the first week was all 5 days, 3 different chemotherapy drugs. Then the second and third week each were just on Mondays, and that was just the one chemo drug called bleomycin, which turned out to be my enemy. That one, that's the one that kicked me in the butt real bad. It was pretty rare that I did make the Mondays on the second and third weeks because my body was just, I was down.
Is it the same like volume and everything? It's just you get 5 in a row, then they just space it out, but you're still getting hit on those following weeks with what you just got hit with 5 days in a row.
Yeah.
And it's like
Man.
8 hours, right?
Yeah,
Each
it
day.
was, yeah, each
Full
day. I
day.
called it the 5-day week. I called it my hell week.
That's a full-time job.
It was, yeah.
Hours.
We were there
Just
usually
getting
at,
chemo like it's
yeah.
your full-time job, literally.
We're usually there 8-9 a.m. and last one's to leave.
Yikes.
And it was long days. And then since I had every side effect I think that you could have got with it, it seemed I had to have blood transfusions and stuff. And them things they're 3 hours minimum for
Yep.
one of them. And I usually had to have 2 units. Well, then you're doubling it, you know. And
You had to have breathing treatments.
breathing treatments, oxygen, and
How did that come about? Just from exhaustion, you weren't able to.
A lot of the bleomycin affected my lungs, kind of like crystallized a little bit in my lungs at some points, and it made it difficult to breathe. There were sometimes the Mondays. Props to my partner over here. She, I swear, she carried me in there one day.
Yeah,
I couldn't do it.
yeah.
It took everything I had to shower, you know,
Yep.
and she got me there, propped me down. We got after it, but it was it was a mess for a little bit there. It was really tough.
And you had a blood clot.
Yeah, blood clot was where my port was at, where
So
it
you
went
get
into
different
my
drugs for
vein there.
that.
Yeah,
Just
so
The complications you can run
it was
Oh,
into.
my
yeah.
goodness,
Weight
yes.
fluctuation was horrible. I'd go up and down 15, 17 pounds
Yeah.
in a day
Did you get kind of
In a
puffy?
day?
because of the fluids
Yeah,
and
the
stuff.
fluids
yeah.
you retain, and then
Yeah, that was pretty. I did that once or twice, I guess, but
Yeah.
it wasn't uncommon. Then I have to get something. I retain the fluids, and then I need a drug to make me get rid of them.
Yep.
And it was yeah.
Lasix and
Yep.
stuff like
yes,
that.
yeah. Bless his heart. The
Then
LASIK.
I'm carrying that little gurney around every 5 minutes to the restroom.
Yeah. Did you get any like edema or anything like that?
your
Yeah. When
ankles
you're-
and feet.
Yeah,
Yeah.
ankles, feet swelled up. I've got some pretty bad neuropathy
I had
right
that
now.
for a long time.
Yeah.
When did you well, I don't want to get too far ahead, but you had 4 rounds of that. And then, so like when did treatment end for you?
So my last treatment was on September 27th because my birthday is September 25th was my 50th birthday.
Awesome.
And again, props to Siteman there. It was pretty much a party all day. I had my favorite chair they saved for me. They had my favorite drink, candies and all kinds of stuff. I got to ring the bell on the 27th. No, I'm sorry. Yeah, my last treatment, 27th, is when...
Because of that bleomycin, he should have had 2 more weeks of the 1-day treatment, but since the bleomycin caused so much problems, Dr. Visconti decided,
it's not worth
it. It's not worth it.
Tearing you down.
Yes, because his lungs were getting
and I questioned
rough.
that, though. Okay, I'm on this for a reason. Do I not need this? And kind of what I got out of it was it's kind of the icing on the cake drug. And
sure.
I could probably do without it at the end of it there. The other drugs should have still done the good job, and they did.
And that's why everyone's cancer treatment is individual because, like sometimes the treatment itself can make it worse, make you worse than where you were at. And people can say, or you have to wait another week or 2 because your body just isn't even strong enough to take another round of chemo. Like every person's story is so singular and individual because of the way their body is made up or their, so to be able to have that option to say, I can't, this is ravaging me.
You run up against that quality of life conversation at a certain point. Are we doing more damage than good here?
Yes. His white blood cells dropped down to absolutely nothing. So I locked him indoors. He wasn't allowed to go anywhere because I'm like, we can't take the chance of you catching something or getting sick,
right?
So.
And I was stubborn. I was not wanting to miss anything. My son was playing football and whatnot, and I was wanting to go to the games. And
then my
warden over here that I called her for a little while. There,
That's what my husband calls me.
She
all the time.
Let me do it. Yeah, and this was probably the right call, but.
So you guys had at home, you have how many kids at home?
We've got 1 at home.
Okay.
I've got 2 older children from a previous marriage.
Okay.
29 and 27.
Okay.
My 27-year-old daughter has my 2-year-old grandson.
Gotcha.
And then we have a 13-year-old at home is 13.
That's the one that was playing football that you were wanting to make those games.
And he had his swim meets. And I mean, he hated missing. I'm like, man, you just got to. You Devin understands. He knows.
Yeah.
But it was hard.
Yeah, I was going to ask, how was it for each of you? I'm sure you had never been this sick before, so I'm sure it was a very I don't want to put words in your mouth, but I think
it's humbling, right?
Humbling, like demoralizing, emasculating in so many ways.
Yeah.
Which how I would, how did you guys work through that, and how did you surrender to let Robyn just carry you through this part?
I really didn't have a choice. My body was just, you need to shut down, and about day 3. Of the hell weeks. I was driving home. We did great. About day 3 is when it started to hit me. Day 4 and 5, Robyn was driving. I was laying back in the passenger seat, helped me in the house, plopped me in bed. That's where I stayed. There was no other option. I could not hardly function. I credit the people there, the staff. We've made so many friends. From the front door lady to the volunteers that come around just to talk to you. Not to mention the nurses. Just wonderful people. That day I mentioned when Robyn had to pretty much carry me in there, you go to a first waiting room where you just got to sign in and they give you your bracelets, to scan your arms and your medicines in and stuff. Miss Teresa was her name. Hey, Mr. Jeremy, how you doing today? Every morning, knew me before I could even come in. And Robyn plopped me down in the chair, and Mr. Jeremy ain't looking too good today. And so I'm not feeling real good today, Miss Teresa. And there was a waiting room full of people. I mean, she dropped me off, had to go park the car still because And by the time she come in, I just looked. I was kind of in a daze sitting there. I feel my arm lifted up, and my band's getting put on my arms in my waiting seat. And I look up at it, and it's Miss Teresa. She goes, "You just get on back in there, And I looked at all them other people were madder than hornets at me, I think. But I was like, wasn't that wonderful? She knew I was suffering at the time. And she got me in there. So, and the nurses, godsends, angels, they know everything about you. And there's, like I said, I had a hard time. We were, putting names in our phones because there's several that work there, trying to remember them from day to day, which eventually we did, no problems. But they have hundreds of patients that they knew everything about me, knew my kids, knew my dogs, knew, it was very impressive, very, very wonderful.
Yeah.
I couldn't believe it.
How did you handle communicating with your son about what was going on?
It was hard. Our 2 older kids, I mean, they took it hard too, but they were at least able to handle it.
Yeah.
Devin, he shut down. He, I tried to tell him or try to talk to him about it, and he'd be like, I don't want to talk about it.
No.
I don't want to talk about it.
Yeah.
And I just tell him, okay, Dad's sick right now. He's really sick, but he's going to be fine. We're going to get through this, and he was very good and
Very good, helpful, yes.
And his buddies were good about texting him and checking on him and saying, if you need to talk, we're here. But it took a toll on him. It was pretty hard. I mean, he was 13 at the time, and just...
Yeah, and your dad is...
Right. You don't expect to see your dad sick.
In such a way, and to see him brought down like that.
Yeah.
Were you able to get over after a little bit feeling bad about covering how sick you were in front of him? Because you'd think, that's a parent's instinct.
Yeah.
I don't want them to see how sick I
absolutely.
am.
Yeah.
Did you get to a
Absolutely.
point where you were like, this is just what it is?
Yeah, pretty quick, I think. He, smart kid, he knew. I'm very healthy otherwise. I rarely got sick. And to see me like that, I think, and he knew this ain't right. Dad's really down right now. So he really stepped up. I think he did really well. And as a 12, 13-year-old kid at the time, and I was very impressed.
So you had 4 rounds of this treatment. They were about 3 weeks each. So we'll call that 3 months basically of this chemo regimen. When you get through that, where do you go from there? Is it a CT scan immediately to check where you're at?
It was, yes.
And how did that go?
It went great. And he didn't hold back. He was, yep, you're good. Your numbers are looking good. The lymph nodes have come down to the acceptable, size that they were there, because they must have been rather large. They weren't as small as he wanted them to be, but they were still acceptable to be considered full remission.
So you got 2 clean scans under your belt.
Yes.
I would imagine most men are probably not as forthcoming and progressive about getting something like this checked out as you were.
Probably not. All right.
I mean, can you imagine what this could have turned into if you
yeah.
hadn't acted as quickly as you did?
Oh, yeah. Dr. Visconti said the next step would have been the brain.
Wow.
So that's where it would have gone to.
Travels up until it hits the brain, and then
And it got to your
it was
clavicle.
all up in my clavicle area
Wow.
where it reached.
You're very lucky, I think, that you found that when you did, and smart that you act so quickly.
Right. Thank you.
And the side effects of the chemo have way outweighed any side effects you may have had from just the removal of.
Yeah. I actually made a joke when it first diagnosed, I think, that I got scolded for. Hey, cancer, maybe I'll lose a little bit of weight out of this. Because, correctional officer, I've gained 30, 40 pounds that I probably don't need on me. And then I get a good hard slap because it didn't happen.
But you did, but your hair grew back thicker.
The hair.
Yes.
And see, my brother is bald. So when I lost my hair, he loved it. Oh man, you're gonna rock it. Keep it. We'll look like, man, dude, I want my hair back. And it not only grew back, it grew back thicker, and it grew back darker.
See, this is my biggest problem with chemotherapy. This is bullshit. I didn't lose any weight. I got puffier.
Yeah.
I didn't lose all of my hair, and it didn't come back any thicker. So I got no, other than potentially curing my cancer. It didn't help me out, aesthetically.
Was no benefit. And this, right now, this is the longest my hair's probably ever been.
Oh, wow.
All right, well, good for you.
Yeah, that's great. Way to go, Jeremy. Do you mind me asking how old you were when your dad passed away?
I was 14.
You were 14.
Yeah.
Okay, so your son is about the same age you were when you were diagnosed.
Yeah.
How did you navigate the fear?
Right.
He was going to have to experience what you had to experience. How did you work through that?
I really don't know.
We set him down.
We set him down and just talked about it, and yes, this is a possibility that this could happen. And he's our miracle baby, we call him. We had to do in vitro to get him. Later in life, we were mid-30s.
35.
35 before we had him stuff. So he's outgoing, just great kid. It was hard. It really was.
It's hard to see the fear in his eyes, and And we're like, do you have any questions? Do you want to talk about anything? And he's just like, you're going to beat it, Dad.
Yeah.
You got it, Dad.
I'm the biggest fan, yeah.
So,
and he'd come in when I was sick. He'd come in and lay by me for a while. Who does that with their dad when they're 13, 14 years old,
A kid that loves his dad.
Oh, yes. Oh, yeah.
A kid that loves his dad
Yep.
does that.
Yep.
Yeah.
So what would you say to someone facing the same thing that you faced, or or what would you say to somebody that's going to be supporting somebody going through it?
You just got to stay strong. You got to stay as positive as you can. Still live your life as best you can. It's weather the storm. Hopefully you will get through it. I've got a sister-in-law who had double mastectomy, and she was the most upbeat, positive person. She went back to work as quick as she could, and
She's
I know
amazing.
she felt terrible.
Absolutely amazing.
And
It's
I was
no
like,
joke
I got to
of a surgery.
channel my inner Nicole. I said, I got to channel my inner Nicole to stay positive.
Mm-hmm.
And I said, I think actually it has made us stronger,
Oh, yeah.
our relationship, without a doubt. I said, I hated seeing him go.
Yeah, she's seen me at my worst.
Yeah.
So.
Yeah.
And there would be times he'd be struggling and be like,
Yeah.
I know it's awful. I know you're going to be mad at me, but we've got to do this.
Yeah.
We've got to. There were many times you were mad at me about because
Yeah.
I wouldn't let you go places or go do things. But I'm like, I'm just
But you're
looking out.
fear-stricken. You don't want to lose him.
Right. I said, so.
And
I
you're
was
in the
just-
gutter, so you're irritable as hell when
Oh,
you
Yeah.
feel
without a
bad like
doubt,
that.
yeah.
I wasn't having it.
And so that's a lot of times I'm thinking he's just snapping just because he doesn't feel good.
Right.
It's not because of, and I would have to remind myself that too. And
Yeah.
I'd have to step out of the room, take a deep breath and be, and try to get him to, drink something. Like, you need fluids. We got to find something that you'll eat.
And again, like the message is don't wait.
Yeah, don't wait.
Don't wait.
Don't worry. Don't worry about the inhibitions, the embarrassment you might feel because of it. Just the end goal is to be better, and it's you need to do that to do it. You got to do it.
Right.
You
got to be aware of your body. You got to listen to your
Yes.
body, know your
Yes.
body, and advocate for your body.
Yeah.
Correct.
Yeah.
Well, thank you guys so much for coming in,
you bet.
for sharing your
Thank you for
story.
having
It
us.
goes a long way to help people going through it, people supporting those going through it. It gives me a lot of hope for being 50 years old with a 13-year-old at home.
yeah.
So if you guys are doing this great at 50, there's a little bit of hope for me. So I feel a lot better.
Yeah.
Thank you.
Thank you
you
guys
very
so much for
much.
coming
Yes.
tonight. Enjoy that retirement. You deserve
Oh
it.
yes, thank you. We will.
Thank you.
So there's so many questions that I had that I wanted to ask Jeremy, but I knew that Dr. Visconti, you'd be joining us. So thank you so much for joining us now.
My pleasure.
You are Jeremy's medical oncologist. You
Yes.
are WashU Medicine medical oncologist.
Yes.
I have so many questions.
You always have so many questions,
know.
but especially now that it's a cancer specific to men.
I know, because I'm just so curious. And
Yeah.
my first question is about testicular cancer. How rare is it, or how common is it?
So it's very uncommon. There's about 10,000 cases diagnosed in the United States per year.
So we did an episode, I believe in season 2, about prostate cancer that was fascinating because I think there were even people in our building after we recorded that didn't exactly know, men and women, what the prostate did. So would you be able to give a breakdown of the testicles? You
Sure.
called them testes, and then you said scrotum. Like, give me the.
Can we use a different word than breakdown of the testicles?
Could you give me the biological and
was just going for a joke.
anatomical?
That's a
I
reasonable
know.
way to say
Could
it.
you go for the anatomical? Tell us about the
So,
testicles.
so testicles or testes is synonymous, which is the same word, same definition. So testes, or you could use just testicles versus balls.
Yeah, if you're feeling fun that day.
That's right.
Yes.
That's right. And what is the main function of a male's testicles?
So the main function is reproduction. It is to produce testosterone, which is the key male hormone for men, in order for them to have an erection, in order to copulate, to have sexual intercourse for conception or for pleasure. It is also, the testosterone is an important hormone for well-being and quality of life for a man, for day-to-day activities, muscle strength, physical abilities, stamina, endurance, and everything else that a man prides himself in.
Gotcha. So you hear a lot of times people can go with just one kidney if they have to get a kidney removed. And I've heard this said multiple times. You can have just one testicle. And does that mean you as a male haven't had not been affected if you have a testicle removed, if you've got
So
if you've had testicular cancer?
Sure. So you could have one testicle removed and you still can be fertile and can make babies and still have good quality of life, good well-being and hormones, and it is still without much major effect. You could see a drop in the testosterone level from a higher range than the normal down to a lower range than normal, and sometimes that may affect the stamina and endurance, and that is just evaluated by case-to-case basis on the individual going forward in their lifetime.
Is that a case where I'm curious if it's something where the body compensates maybe?
It probably does, yes.
And there's also testosterone therapy as well.
Correct.
Yeah, as Laura mentioned, she has lots of questions, on this kind of thing, whereas I have lots of questions when we have, topics on, ovarian cancer or breast cancer. Do you find that most men, when they come in to see you, have a base level knowledge of this? Is it a variety of awareness? Are they, you know what I mean? Like, do some men know nothing about it and you got to fill them in, or do they go, yeah, I know I'm good with one, let's move on?
Most men don't know anything about their testicles. They know that their testicles are important in sex and in making babies, and that's pretty much it. And as far as anything else, their education process is not there through the private or public sector, and as far as them wanting to figure out their anatomy and so forth. So no, most of the time they're ignorant of what more the testicles can do, how important they're needed, and so forth. They just equate that with having sex and making babies.
Well, there you go. There you go. There's no dumb questions.
No.
Because we were talking about beforehand. I was like, I was wrong. I was like, I think most men kind of know the basics on this, and Laura's like, well, I'm going to ask anyway because I don't know, which is fine. But I think it's nice to know that. Like,
Yeah.
even a lot of men, when they go in there, they're going, I don't even know what I'm dealing with down here.
Well, literally, a lot of men didn't know exactly what their prostate does, right?
Which is wild to me. But
Well-
maybe it's because I co-host a show about this kind of stuff.
Right, but I didn't know. Like, the doctors explained, like, it's what helps give the semen its trajectory, but I had no idea. And then also, like, we've had episodes where where I've asked the doctors, okay, so about uterine cancer, like, so why, if you lose your lining, can you get uterine cancer? I mean, we are all not, most of your patients are not doctors, so why would they have all that education, right?
Correct.
I mean, I think it's fair to say most people don't know as much about their bladder unless they get bladder cancer.
Right.
They just know when it's full and it needs to be emptied.
Yep.
So you have
That's exactly right.
you have a lot of education on your to-do list when you have a patient come in.
Yes.
You're bringing them up to speed on many fronts.
Yes. Basic understanding of the cancer of that organ or gland, and what needs to cure the person or treat the person. You also need to also explain to them, yes, the function of that organ.
So we've covered that it's pretty rare, testicular cancer.
Yes.
When do people normally get this? How does it typically present? At a certain age?
So there's two peaks. So the major peak is anywhere, and you could look at different textbooks and stuff like that, but I'll go with 15 to, let's say, 30 years of age, okay? So, and then the second peak is in the 50s and 60s of a man.
So it wasn't that rare that Jeremy had it. He was in a second peak phase. He was almost 50.
Yes.
Okay.
Yes. And so those are the two peaks. Most, as I said, most of the cases is when they're young.
Mm-hmm.
It's understandable when they're young, maybe the higher testosterone level, is there some family history, some genetics, something like that could happen. But the second peak, more than likely, it's probably environmental induced. Again, back to, whatever is the cause that we'll eventually know when we are able to assess each individual's genomic sequence.
Mm-hmm.
Okay, and that I think will give us a lot of insight into the person, their health, what's their risk for, and what may be causes of some of their diseases.
And Jeremy had a lot of pain that came on kind of suddenly, and then he said it felt like there was a piece of popcorn that popped inside his scrotum. So is that how it often presents?
So no, it often presents as a painless enlarging mass that is not separate from the testicle. So
Like it's swollen?
Yes,
kind of?
swollen. So I'm going to make an assumption that every man has at least examined themselves and knows the contour and the size of their testicles.
Especially like on a given weekend watching sports.
Correct.
Yeah.
Correct.
Or a movie.
Correct. And so they know their anatomy. They know that part of the body because it is an important part of the body. And so when you feel something, which may be a sensation, maybe a twinge of pain, and you feel something that's a little bit abnormal, then that is something to be investigated. And usually this will be painless at first and eventually will grow to a certain size. And then it's when it gets too painful, or if it starts to bruise, or if there was a hydrocele, which is kind of a water-filled sac that's sometimes noted in men's scrotums, then that can burst and become painful. Mm-hmm. And so then you start having pain and discomfort. Sometimes it's a lot of swelling of the scrotal sac, or where it's uncomfortable to even sit or put underwear on. And the other thing could be just redness of the skin, which can develop.
Do you find that young men are they more inclined to ask to be seen? Or are they less inclined because they're younger and they're either embarrassed or not very knowledgeable? What do you find?
So most of the time, something prompts them to seek medical attention. Pain, okay, as Jeremy has alluded to, okay, or it is they're having difficulty with sex, or it's really grossly swollen, okay, and uncomfortable, or if they have a support like a family member that would prompt them to seek medical attention. Because usually, if it's a single guy who's young adult, or young or older teenager, if you will, yes, embarrassment, number one. Two, they are probably not ignorant of the fact. Three, they don't want to go to a doctor. It'll pass. Something will resolve. Maybe they injured themselves playing sports, or twisting, or picking up something, or they may think it's a hernia, which is not nowhere near that section of the body.
I asked Jeremy if the surgery was painful, and he was like, it really wasn't that bad at all. The chemo was hard. And then he mentioned how that you guys went in the surgeon went in laparoscopically and it was removed internally. So
they go into the skin or the inguinal region, which is kind of the groin of the one side. So if it's a left testicle that has a mass on it, then they'll go into the skin above the penis and scrotum which is termed the inguinal. It's kind of close to where the connection of the left upper leg and the pubic area is. Okay. And so they make an incision with a scope and go through that because they can, because the soft tissue underneath will separate and then get into the scrotal sac, and that's how they remove it.
But do you find a lot of patients complaining about the pain afterwards?
They're sore for probably a couple weeks, just like with any type of surgery, but it goes away.
Gotcha.
Okay? And so it's not that type of bad postoperative pain or discomfort. And the reason for this, and also if we even talk about why don't we just do a biopsy if there's just a mass there, is contamination. So if you go through the scrotal sac through the vasectomy, you can contaminate the scrotum with cells that may break off. And that's one concern, okay? And so the reason for what is termed an inguinal orchiectomy, which is the inguinal region of the pelvic area, going into an orchiectomy as removal of the testicle, is to prevent the contamination. And plus, it's more technically easy to do it that way, to remove the scrotum. Biopsy, you can't just... If you think about it, I'm sure Patrick and I would just consider a needle coming at us. We'd be very twisting in our chair, and that again is a contamination issue. You go in through a scrotal sac with a needle, ultrasound guidance, you'll contaminate. If that's malignant, you'll draw cells within the sac, and then that becomes a problem for the future because then you'll have recurrence of cancer within the scrotal sac, and then you run into the problem with the other testicle. So you never biopsy.
That's so interesting because Jeremy brought up that they didn't biopsy, and we're like, why? And he's like, I don't know.
Yeah,
That's so interesting. You don't want to just give more room for more malignant.
Correct.
Which is something in itself I think is very interesting too that I've learned about cancers is, you'll have a resection of some sort surgically and they'll talk about the margins. The margins were clear. I'm starting to learn that, I would think of it like, it's almost like they're concerned as if the cancer is going to spill like it's a liquid into something, but you are in effect you're risking the pulling of cells and kind of implanting them elsewhere like blowing on a dandelion.
Correct.
So yeah, if you're going in somewhere and they can't get a clean margin, a lot of times that's what may make it inoperable because you might just kind of spread it.
Right.
But
Yes.
it's a weird thing to picture
Yeah.
what the disease physically looks like inside of someone. And it can vary, obviously, but
Good job with a flower reference instead of a sports reference on that. You said dandelion. Good job. I'm proud of you. I'm proud of you on that
I could
one.
easily,
That's right.
like a blitz.
Yeah.
How and when does humor come into play when you're speaking with the patient? Because cancer is not a fun thing. It's not a silly thing. But then again, men are childish and testicles are kind of ripe for humor. And I feel like some people would feel inclined, myself included, to kind of lead into the humor as a defense mechanism. Do you have to tolerate some silliness when you're speaking with certain patients?
Good question. So first visit, first consultation, I let the patient do the humor first. They would initiate that. I would never do humor first. Cancer is a serious disease, and initial consultation is always serious. So breaking the ice would be talking about where they're from, what town, talking about their family, trying to get some family history as well during that time, what they do, occupation, stuff like that. And if they want to start to initiate jokes, then I will go and take that as a direction. But it's only when I have established a good relationship with that patient for future visits that I will go ahead and start maybe doing some humor, dry humor.
Right. You let them set the tone.
Sure, correct.
That seems like the right way to put
Yeah,
it.
exactly. What about Jeremy mentioned that when he had to get his testicle removed, he was like, I was almost 50. I was done having kids. It didn't bother me. But if you're looking at the younger age men from 15 to 30, many of which have never had children yet, what type of things are put in place to, number one, if they want to get a prosthetic, if they want to keep the look the same, or number two, preserve their fertility for any issues down the line?
Good question. So anyone who is in that young reproductive age and they've not been married or just newly married or haven't had children, immediately after their diagnosis, they're sent to the reproductive specialist to bank their sperm, to freeze their sperm. Because so as you remove one testicle, then you do have a 30%, 40% chance of sterility with losing one testicle. Odds are you still can reproduce with one testicle, but it's always important to bank the sperm, especially then if the individual has to get chemotherapy, which can further destroy the other testicle and reduce, the testosterone. So banking the sperm is always important for young men, irregardless whether they're single, newly married, or haven't had children. Even though they may say, "Oh, I'm not going to have children at age 21," I said, "No, let's just bank the sperm. We have time." Okay. Someone who's in their 50s and 60s. Essentially, I do offer that if they are still wanting to have children, or if they have a young wife or whatever, or they're seeking a second marriage, if they're divorced, then I could offer banking a sperm. Usually that's very uncommon for that age group. That's the reproductive portion of trying to preserve fertility. The other issues of prosthesis, yes, the urologist can do a prosthetic testicle, so it's uniformly you could have that. Most men don't do that, okay? it's usually very uncommon for that to happen. It's only if both testicles are removed due to testicular cancer in both testicles or for what other aspects of their health that maybe a penile prosthesis can be put in.
What about immunotherapy and testicular cancer? Has that shown any promise? Because I know that Jeremy's chemo was a very, very high dose and effective at this point. We know that it's really lowered and shrunk those lymph nodes. But what is immunotherapy showing as far as possible promise?
So if we go back to how uncommon this cancer is, so let's say 10,000 cases in the United States. So clinical research is very difficult in testicular cancer. You don't have the numbers. Mm-hmm. So for meaningful research to test a specific drug or a new technique, you need a conglomeration of different cancer centers across the country or even in the world to accumulate the numbers in an expeditious fashion to see if the standard of care changes. And so it's very difficult. So therefore, because testicular cancer is highly curable, and in fact, it is the most curable cancer in the world.
Even over thyroid?
Correct.
Wow.
Therefore, research in this fashion is mostly just fine-tuning things and not discovering new drug therapies.
I see. So immunotherapy, it's not going to be drawing numbers, nearly enough patients to then set a new standard of care.
Correct.
And it's so curable with chemo as is, there's probably not a ton of money going into funding a study such as that.
Correct. If I want to take an example that of this celebrity that had testicular cancer, his name is Lance Armstrong. Yes. Mm-hmm. So his presentation was highly unique. He had so there's no stage 4 in testicular cancer, so he had stage 3. He had cancer in the chest, in the lungs, from the testicle,
and he also nodes, correct?
In the lymph nodes, and he also had a tumor in the brain.
I didn't know that.
So he underwent a combination of surgeries and chemotherapy and is cured. And he had resection of the tumor, I believe resection of the tumor of the brain plus or minus radiation, but then he had resection of the lung nodules, or they resolved from the chemotherapy. And so it's a lot of positivity with that. And so you'd think in any other cancer, that person would be incurable and would have died. And his cancer, which was a germ cell tumor, mm-hmm. or which was a non-seminoma germ cell tumor, was responsive to all the oncology treatments.
Is that why there is no stage 4 for testicular cancer? Because it just doesn't really get to that point typically?
Correct.
So and forgive me if this is a silly question, but whenever we have, awareness months, there's always like a takeaway, when we're trying to make people more aware of testicular cancer. As a medical oncologist that specializes in treating these patients, what do you want men to be aware of when it comes to testicular cancer? What do you want them to know?
So it's a very simple thing. I mean, frequent examination of the testicles, and anything abnormal, then seek medical attention right away. Even if it's maybe inflammation or infection, you still need to be evaluated by either the primary care doctor or a urologist. Usually the primary care doctor would be, at that point, will evaluate where they could initiate the ultrasound to see if this is truly a malignant tumor versus, let's say, infection or inflammation or something like that. And so that's what that was really basically the bottom line of recommending that to the general population of young men and even middle-aged men, just to be checked out by a specialist.
Jeremy said to his wife, said to Robyn, well, tell me if you feel this. And she's like, well, I don't know what those normally feel like, but shouldn't you know? And he said he knew right away. So why don't we see those posters up at the doctor's offices? Because it's rare
Because it's rare and there's no screening procedure or test per se for an individual to do. It's not brought up by physicians.
Yeah, that makes perfect sense. I guess it's really fair to see that men really have to take it into their own hands.
See what you did there.
You like that?
Yeah. So, what would you like to see change, if anything, in the way that it's marketed or studied?
So I think pediatricians, it would be nice if there's some education with their health, as they go from leaving their pediatrician at age, let's say 20, 21, to an adult physician, that there's some recommendations given to get them established if they're still under the parental house. So I think that needs to have continuity of care from the pediatrician to a family practice physician or internal medicine
that's a great
doctor.
suggestion.
So it sounds like testicular cancer in a nutshell, no pun
Pardon
intended.
that.
Pun intended. It's very treatable. It's highly curable, rare, but you just really need to be doing the self-checks once a month.
And the earlier you could pick it up, the less amount of treatment you need, regardless of whatever that treatment is. So, yes, my advice to impart to all men is to be aware of their body, their testicles, their scrotum, to examine them at least once a month, if not more frequently than that, and then report to their physician or specialists any abnormalities that have developed.
Yeah, I really appreciate you coming on today and answering all these questions. And I learned a lot on this episode.
Same.
Yeah.
My pleasure. I'm happy and honored to be here.
Thanks for listening to This is Cancer,
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and WashU Medicine.
national leaders in cancer. For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.